All right, good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton and Montgomery County. Thank you for being here today to where we can provide an update to our community regarding our COVID-19 response actions. We're also pleased today that Mayor Nan Whaley is here to provide comments, Sarah Hackenbrack from the Greater Dayton Area Hospital Association, and Michael Doan, Public Health Medical Director. So today on Governor DeWine's news conference, he talked about a reopening in a very slow fashion beginning on May 1st. And it would be a tiered approach. And it's important that we get this right from the very beginning, because I think it's important for all of us to understand that together we need to navigate our new way of life, and we have to do that in a safe way. We should all be tremendously proud of the work that we've done collectively, both public sector, private sector, and citizens. And we've made great progress in flattening the curve in this state as well as in this community. But we have to recognize that the COVID-19 virus will continue to circulate. It's not going away. As we begin to slowly reopen the economy on May 1st, we need to understand that we expect to see an increase in cases. That's simply going to happen as more and more people engage in workplace settings. So moving forward, the curve that we've flattened will begin to look different. And last week, Dr. Doan walked through what the next version of that curve may look like. It will never go away, and it will simply modulate, more like a roller coaster, much below the threshold for overwhelming our hospital systems, but that curve will modulate and we'll see periodic spikes in cases. And we're particularly concerned about that because as we begin to reopen, there's the potential for people to come into close contact, and then we're always concerned about congregate care or congregate living conditions or facilities such as nursing homes, assisted living facilities, homeless shelters, the jail, etc., residential treatment facilities, and so forth. So moving forward, we need to be very purposeful in how we begin to reopen this economy. Keep in mind also there's a tremendous amount of uncertainty regarding immunity following infection. So we have that uncertainty, we have no vaccine, we have no antiviral treatment other than supportive care. And public health needs to continue to do contact tracing. We have a workforce of about 30 individuals right now who are making sure that we identify ill individuals and they get isolated, and that close contacts then are quarantined. As we move forward to continue to do our work, it may be that we need to double that number of individuals doing contact tracing. And so this is going to be a big lift for public health to continue to be able to track this virus. And then we should all understand that social distancing will be with us for the future. And that is not going to go away. It's pretty clear that the governor and the director of the Ohio Department of Health have indicated that social distancing will continue as we move into the May time period. And I think we all need to get more comfortable with the concept that we've been talking about, wearing cloth face masks. So just real quickly again on those cloth face masks, because this is going to be our new reality. We know it's a recommendation at the federal, state, and local level. There are obviously limitations there. We can't have young children under the age of 2 wearing face masks, and or anyone with breathing difficulties, it gives them trouble breathing. They should not be wearing a cloth face mask. However, we know now that the virus spreads by coughing and sneezing, as well as through normal talking, normal breathing. So, and we've talked for the past month and a half at these news conferences, our early understanding of how the virus spread was we said when we cough and sneeze, we generate these large respiratory droplets that then, if someone's in close contact within 6 feet, they directly inhale that through their mouth and nose. Or we cough or sneeze without covering onto a surface, and then we touch that surface and then touch our mouth or nose, and that's how we infect ourselves. But now the data, the research are starting to show that just through normal talking, we can shed that virus. And those particles that we generate are much smaller. We don't call those respiratory droplets. We call those aerosolized particles. And they can stay in the air longer than a respiratory droplet. And they can then become dispersed more rapidly and more uniformly throughout a room. They don't settle out as quickly. So that's a concern for all of us. And that's the purpose of donning a cloth face mask. So think of it as source control. We know we shed the virus. That cloth face mask can help us not spread the virus as much to other individuals. But we have to understand that it doesn't prevent us from becoming infected. It simply cuts down on the amount of virus that we generate out into the open space. Also, it's not a replacement for social distancing, and it's never a replacement for hand washing. So we're simply asking again that all individuals consider wearing a face mask when around other individuals and in public. And I think we'll see more guidelines on this and perhaps even some requirements through the governor's office and his orders as we get closer to May 1st. So with that, we would like to welcome Mayor Nan Whaley to the podium.
Well, you were a little terrifying today, Commissioner, when you talk about the way it spreads and how we're learning more about this disease. And I know that it's hard for folks, but remember that this disease is pretty new and we're still learning about it, and more data continues to come in, and so that's why this work that we're doing to protect ourselves and provide physical distance is so important. I appreciate all the commissioners' great work as we continue to learn more about what causes the spread of this disease. Today, I mentioned last week that we had a great donation from Henny Penny, donating 2,095 masks. And so I just wanted to share with everyone and thank folks that have really come through, particularly to the City of Dayton first responders and the city as we have continued to work to try to keep folks safe. I think there's been some coverage of Bell of Dayton, but Bell of Dayton has donated a large amount of liquid hand sanitizer to our folks, and we appreciate that as well. As I mentioned, Henny Penny has donated N95 masks. Also, Hendrickson donated 195 masks to us. And then Meyer gave us a discount on some spray bottles for said disinfectant, and we appreciate that. We've also received some donations of Lysol spray and towel rolls. I mean, it is that kind of work that at the beginning of this we had a hard time finding from Five Below and Dollar Tree up in Heber Heights. And so we really appreciate folks in our community that have stepped up and have helped us. And certainly Henny Penny's donation of 2,095 masks, since they had a distributor, has gone a long way for us in the city of Dayton. I want to just encourage folks again, as we are in weeks and weeks of this way that we are living now, that it can be a strain on folks mentally. We're encouraging people to think of, if you're in good spirits that morning, think of 5 people that you want to reach out to just to check on. Or if you're not in great spirits, that could be a real help to you personally as well, checking on others. And so we're asking everyone to find 5 people, strive every day to reach out to 5 different people that you may not see that's in your house, and just see how they're doing, either by calling them, by FaceTiming them, but make it a little deeper than a text message. I think it will go a great way for our community. Our community's still doing great. They're doing great work following the order. I think I really commend public health and the work that they've done to continue to communicate it, to put resources in this. And as we continue to learn more about the governor's next order, we'll work to make sure that we're prepared and can work to educate the community about exactly what that means. Thank you for your great work in staying safe. Enjoy the sunshine apart from your neighbors. Have a good one.
Thank you, Mayor Whaley. Next, we have Sarah Hackenbrack.
Thank you, Commissioner Cooper, Mayor Whaley. Our hospitals in the Dayton region and connected to the Greater Dayton Area Hospital Association remain safe and ready to care for you. And we continue working together to build new layers of planning into our surge capacity planning. We are now looking in partnership with nursing homes and local health departments in regards to how hotspots may impact our region's hospitals. This allows us to focus more deeply on how our hospitals can engage with congregate settings and can assist them should a hotspot begin to emerge. As the Commissioner has mentioned, these are often nursing homes, skilled nursing facilities, jails, prisons, other residential facilities where people live and consider that home, but they are sometimes in group settings with large numbers of individuals who may potentially be at risk for COVID-19. Our hospitals continue to look at opportunities to provide guidance and education to the staff within those facilities on how they can safely and appropriately care for individuals in that home setting and ensure that they can be cared for safely before hospitalization should be needed. We also want to make sure that we are clear and understand the PPE needs of those facilities, the personal protective equipment that those facilities might need, and the PPE can vary from the type of facility to the type of facility. From nursing homes, it's very different than what you might need in a local jail or in a prison environment. And making sure that as we understand what the PPE needs are within each region of the state, we want to ensure that should a crisis emerge, we have the ability to get resupply to those facilities quickly and immediately while we wait on the official supply channels to be activated to get them their traditional materials that they need. The final component of this planning effort really involves our partners in our local health departments and making sure that we continue to build in the testing capacity that we need, specifically for these areas that could be potentially hotspots in our region. The engagement with local public health departments is essential, and that also ties directly back into the strong relationships that each agency has with the Ohio Department of Health. As hospitals, we continue to find that testing remains limited and our challenges persist within this region. What is something important to understand is that lab testing for COVID-19 requires a very specific match of the machines that you have in each region to do the testing and the reagent and the materials that come specifically from the vendor for that supply. So I liken it to using an espresso pod in a Keurig machine. It won't work. So that is where we are challenged, in that we need very specific types of testing materials and reagents for the machines in our region. And our hospitals right now continue to work in partnership to address the immediate testing needs that we have. And again, that happens on a daily basis where we check in with one another, and if supply needs to be shared or we need to cover another facility's patients for testing, we do so here in the Dayton region, because that is how Dayton operates and that is how our hospitals participate with one another. But we have to start looking at where we are now for testing and where we are going to need to be 4 weeks from now when we start to look at what reopening looks like in this region. Thank you.
Thank you, Sarah. Next, we have Michael Doan, Medical Director at Public Health.
Good afternoon. I'm Dr. Michael Doan, Medical Director for Public Health Dayton Montgomery County. They've asked me to say a few words about contact tracing, to review that. Actually, Dr. Acton reviewed that during the governor's conference at 2 o'clock, and so I'm just going to try and amplify a little bit on that and give you a sense of what's going on here in Montgomery County. We are told about all the cases of the coronavirus infection. And so as we get that information in, we then check with that person, if they're not too sick, or other people that know about that person, to determine with whom they have had contact, to try and find people that they may have infected. And we know now that asymptomatic people can spread this disease, and that people who get sick today may have actually been able to spread it for the day or 2 or maybe even 3 before that. And so we're looking for close contacts, household members, other people that sort of surround that diagnosed case. Once those people are found, then we can talk to them about exactly how close that contact was and give them some recommendations. For the person who's sick, they go into isolation. If they're sick enough they're in the hospital, then they're going to be put into respiratory isolation within the hospital. But they would go into isolation. For the people that may have been exposed to it, they would go into quarantine for 14 days. The idea behind it is to try and separate the virus, which, despite the fact you can find it on surfaces and stuff, really is just in people, okay? We're the thing that keeps it going, is to try and separate the virus from other people that aren't infected yet. So the person that is infected gets isolated, you identify the people that may have picked up that virus, and you put them in quarantine, and hopefully that builds like a little island around that particular virus so it doesn't spread to other people. The contact tracing here, we've had, 30 people, as the commissioner said, and they work on a rotating basis, trying to make those contacts and those phone calls. Some days we have a couple of cases and we need more. Some people have a lot of contacts, so we need more people working. Other days there are less people working, and so we can expand and contract that number of people as we sort of go along. Overall, we've had 235 cases in Montgomery County. There have been 344 contacts that have been traced down. And we also have, from earlier on, about 54 returning travelers, people that came in from international destinations when that was still being allowed, and also people coming back on cruise ships, for instance. So we've had a number of people that we've looked at from this standpoint. We've had a number of different people that have helped with this. We've got our own nursing staff. We've got our own nurses that work in disease control and communicable disease control that work on this. We've had volunteers from what's called the Medical Reserve Corps, which is a group of people who volunteer and then can be pulled in as extra personnel are needed. Some of our sanitarians, that would be the people that go out and inspect restaurants most of the time, were also pulled into this as well. And all of these people then, and our epidemiologists, and so all of these people are able to kind of come and help as the need arises. The other thing is that the counties have mutual aid agreements so that if in fact there is a situation in a smaller county where they don't have enough people and they have an outbreak in a facility of some sort, they can call on us and we can send people over to work for them and to try and get things under control and to quickly identify those people and get them separated from other people that they might infect. That's really about the way the contract tracing works. And the whole idea is just to try and find where the virus is with the case, identify where it might be in other people, and then separate that group from anybody else that they might infect. Dr. Acton talked about it in terms of like a fire and sort of trying to smother the fire and then sort of waiting around to see if there are any embers that are going to pop up and making sure that you get those out of the way too. I don't think that's a bad analogy at all. And so that's the idea behind the contact tracing. I would also say, Dr. Cooper, Mr. Cooper didn't mention it, but the masks, there's some studies just recently, when he's talking about those little aerosols and all, it turns out these are pretty good, much better than I think anybody anticipated when they checked them about catching all those aerosols and everything, so that for the people working in the convenience store, customers coming in, they're at some risk because they're seeing hundreds of people every day, any of which might have an asymptomatic infection. And so the people that are wearing the masks are really helping to protect those employees and the people working in those stores. And so, we might run out and just say, gosh, I'm only going to be out for 15 minutes. I'm just going to run to the store, pick something up, and come back. And if you do that without a mask, you may be fine, because it's a very short exposure. On the other hand, the people you're interacting with in that store, they're there for their 8-hour shift. They're going to interact with lots and lots of people. And so it just multiplies their exposures tremendously, which is why it's important that we all try and use the masks every time. Anything else as far as questions today?
I've got a question for that.
Sure.
I'd just like to comment that everybody's analogies were great today. Mickey on the fire, and the Keurig machine. Well done. I completely get it now.
I know you guys, the city commission is doing like virtual meetings and stuff now.
Mm-hmm.
But they aren't doing any kind of public comment or
Mhm.
anything. So why was that decision made, and how are people still getting kind of an remittance about that?
Sure. So the question was, we're having meetings as necessary, but there's no public comment at the meetings. Frankly, just the technology for us to be able to have the meetings on Zoom, get them out to the public, is about the level that we can manage to make sure it stays on the record and we get everything done properly. There is still a great opportunity for public comment, and let me tell you the ways you can do that. First, you can contact me at my email, and every city commissioner's email is the same format. It's nan.whaley@daytonohio.gov. All of those emails are public record, and we respond to every one of those of concern. Further, you can call the City of Dayton's at City Commission office at 937-333-3636. We still have a staff person there that answers the phone for concerns about public comment. That information also goes to City Commission about what is coming through that phone number as well. And then you can also reach out to us through regular applications like Dayton Delivers, the City of Dayton's website, City of Dayton's Facebook, my Facebook, Twitter, LinkedIn, etc. You can also write to us at 101 West 3rd Street, Dayton, Ohio 45402, and we have a section of communications and petitions that people can place things on the record as well there. Any other questions? Oh, on the phone? Any questions?
This is Drew Simon from Channel 7. I just have a question for Commissioner Cooper.
Great, thank you. Put this back on.
Yes, go ahead.
All right. So Governor DeWine obviously announced yesterday that schools, their students having to work remotely for the rest of the academic school year. Now, as we start looking toward the fall, has Public Health had any conversations with, say, local universities or schools that, specifically like a place like UD maybe, that has a lot of students that are living in dorms together? Has Public Health had any guidance, asked them to not have students come back to campuses in the fall?
So the question is, has Public Health had any discussions with local universities regarding their plans for the fall in terms of social distancing? So we're in discussions with the University of Dayton. It's very preliminary. I think we all are adhering to the advice that we seem to be getting from the governor and the director of the Ohio Department of Health, and that social distancing is going to continue. And it's not as if we're going to simply flip a switch and be back to normal operating conditions. So our advice is universities should plan for distance learning for the fall unless we hear otherwise from the state.
All right, thank you so much.
You're
I also
welcome.
did have a question for Dr. Dunn as well.
Dr. Dunn. He'll be right here.
All right, I was just hoping he could go back over the numbers again, talking about the contact tracing.
Sure. So the numbers for the contact tracing, we have 235 official cases in the county. That has led us to 344 contacts that we have traced down. And we also have 54 cases of people returning to Montgomery County, travelers from international travel early on and or cruise ships a little bit later. Are those the numbers you wanted?
That works, thank you.
Okay.